So the first thing I would do is I would log on to the EMR, and then I would want to check the orders, the allergies of the patient and the time that it needs to be given. And then I would check the nursing implications to see if there's any, but furosemide doesn't have any, so we're good to give it. But if there was some, I'd have to use my clinical judgment to see if I could still give the medication or not. And then after that, I'm going to log on to the AccuDose. I'm gonna make sure I check the 6 patient rights in here too. So I wanna check for the name, the full name here, and then the full name's here. So is the MRN, and the date of birth, and the date of birth. And then I wanna check the medication. So it's furosemide and furosemide here. I wanna check the dose. So we have 80 milligrams here, and then we have 2 tabs of 40 milligrams here. So that's the same. And then the route is oral. And then you have tablets, so those are oral. And then I want to make sure that I have the right time, which is 11 here, and then it's 11 now. So I have the same time that the medication needs to be given. And then I have documentation, but I'll do that later on after I give all the medication and everything. And so now I want to make sure I dispense the medication from here. I have the 2 tabs of furosemide for 40 milligrams. I want to check the expiration date and if the package is intact. And then I want to make sure I log out of the EMR and the AccuDose. And then I can leave the room and I will go gather all my supplies needed to pass the meds. So now I'm going to take this over here. And then we'll put these here. And then I'm going to grab my EMR. So going into the patient room, I would introduce myself. I would tell them I'm going to pass the medication, and the medication's furosemide, and it's a diuretic. So it's going to help with the fluid retention going on in your body. And then I want to check the armband for the name of the patient, and then the date of birth and the MRN of the patient on there. And then I'll log onto the EMR, and I'll make sure I check the allergy band as well over here to see if he has any allergies and if they line up to the EMR. And then I want to check the I would wash my hands going in the room too. I would have introduced myself obviously, and then I want to ask the patient for their name and date of birth to make sure that it matches up to their armband. And then I will, so I log onto the EMR. I want to scan the armband as well now. Boop. And then I want to scan the medications as well. Boop, boop. And then I will check the 6 patient rights. So you have the name here, you have the MRN and the date of birth, and the name, MRN and date of birth are on the armband. And then the medication I'm giving is furosemide. I have furosemide here, 80 milligrams, 2 tabs of 40 milligrams. Oral, I have tablets here, so that's oral route. And then the time is on here, it says 11, so it can be given any time, so it would be a little past 11 now. So I'm still good there. And then I will document after I pass the medication. And then, so after that, I want to, I will start passing the med. So I would make the patient, or I would assist the patient sit up in their bed. I would open up the medication on here, and then I will put it into the cup. And then I'll open up this one as well. And I will put it into the cup here too. And then I would give the patient the meds. I would watch them put it into their mouth and swallow it. And then after that, I would document any medications I didn't give to the patient. And then I would give the reason why for that. And then I would verify the time I gave the medication, and I would document that as well as I would document the patient response to the medication that I had given them after I would come back and check on them. And then I would